On the heels of the province's decision to give COVID shots to healthcare workers for free, there are renewed calls for the vaccines to be fully covered for all Albertans. The UCP government reversed its policy for healthcare workers yesterday. Anyone outside that sector who wants a shot still faces an estimated $110 cost. Mark Villani has more on why health experts want the cost barrier removed.
Janine Baxter was set to book her COVID shot ahead of the upcoming school year, but the local teacher was shocked to learn she'd have to pay more than $100 just to do it.
Working in a school, you have lots of contacts, with little people and parents, and it would be nice to be protected.
On Tuesday, Alberta's government moved to cover the cost of COVID shots for most healthcare workers, but advocates say, why stop there?
The government has now admitted that these are a good thing to have access to these vaccines for healthcare workers, so open it up to everyone.
These are an important first line of defense, and this is a critical piece of the protection that we need.
Especially as flu season approaches, some doctors say children remain particularly vulnerable.
We're still seeing kids coming in and they're still quite sick, and they end up being in hospital for a prolonged period of time.
This week, the American Academy of Pediatrics recommended COVID-19 vaccination for all kids ages 6 through 23 months. But Alberta's Minister of Children and Family Services wouldn't say if he agreed or disagreed with that approach.
Conversations are ongoing, and I look forward to the findings from both the health professionals as well as the health minister.
Premier Smith says the policy calling on Albertans to pay for shots is meant to prevent wastage after $135 million was spent on unused doses, but some say it's preventing access.
And we had to get rid of them all.
Pharmacists are concerned after being told they'd be excluded from the upcoming rollout.
So there's some communities that just aren't going to be able to have their patients access care through them. They're going to have to go to another center to get a shot.
The summer of UCP flip-flops.
Meanwhile, Alberta's official opposition says the new policy should also put seniors first instead of making them pay.
So why not make it easier for people to stay out of the hospital if they so choose? And yet this government's blinded by ideology.
And for some Albertans, the cost and uncertainty of getting this vaccine is still concerning.
So that we don't have another epidemic.
And Mark joins us from near Foothills Hospital tonight. So Mark, how is the province responding to all of this, and what do we know about plans for the upcoming vaccine rollout?
Well, Tara, Health Minister Adriana LaGrange says that eligibility as well as the administrative fees and scheduling for these vaccines all expected to be available soon. Those details coming maybe next week. We're still waiting for those answers. Meanwhile, the province did previously say that people with underlying medical conditions, including AISH recipients, will receive this vaccine for free. Alberta has also ordered 485,000 COVID doses. That's about 250,000 doses less than were administered last year. We're being told that Albertans can pre-register for their COVID shot ahead of September 30th, but it can still be difficult at this stage in the game, as many simply just don't know if they're going to be getting a free COVID shot or if they're going to have to pay out of pocket. Tara.
Okay, Mark, thank you.